2 crore 80 lakh people have perforation which needs surgery.
How would I know whether is it a discharge or whether is it just common wax that we have in the ear?
The damage done inside is so much that the hearing loss cannot be restored. Not even with surgery. 2-3 years old children would have this problem far more. It is very sensitive to textures. So whenever you want to feel something, you feel it like that. The general idea people had was कान का ऑपरेशन किया तो तू बहरा हो जाएगा नहीं तो पागल हो जाएगा. She one day gathered enough courage and told me that I want you to operate my ear. We both agreed that yes, she will be the first patient and I will be the first surgeon doing it. And let's hope for the best. I did not know what is happening with her. I would phone her up twice a day. Are you all right? Are you all right? If I change their mindset from what they believe now to what is true, I have done a great successful job of my life.
Absolutely. Ear infections are extremely common. 7 out of 10 people get it at some point in their life. Some of them recover from it. However, some of them might need surgery to recover. A hole smaller than a grain of rice in the eardrum can take your hearing away. Most ear surgeries still require a cut behind the ear. And for some professions, that cut alone can end their career. Now, here's the real question. What if I told you that the ear can be repaired without a cut or a single stitch? No cut, no scar. Sounds unreal? Stay with us because today's story is one of the most powerful medical innovations that you have ever heard of. Hi, I'm your host Shilpa, and in our very first episode, we are going to talk about some of the beliefs that the surgeons questioned for decades together. Do we really need to cut the ear to fix the ear? To answer that, we are joined by an experienced surgeon who reimagined ear surgery. Please welcome Dr. Shabbir Indorewala.
Shilpa, thank you very much.
Pleasure is mine. Dr. Shabbir Indorewala is an ENT surgeon with over 40 years of surgical practice. He is a Limca Books of Record holder. He has been invited as a speaker at Harvard University, and he is the pioneer of Stitchless Ear Surgery. So, doctor, before we start with innovation, help us understand the range, the scale. How common are these ear infections and the perforated eardrums?
2% of all people of this country have perforation, which need surgical repair.
Okay.
Now, if the population of India is 140 crores, 2% of that would make it as 2 crores 80 lakh.
Oh my God.
So 2 crore 80 lakh people have perforation which needs surgery.
Whoa, that's a huge number and absolutely shocking.
That is indeed.
And how do common man know about it in the first place?
Well, he will have some or the other symptoms. The commonest being ear discharge, deafness, or blocked sensation in the ear are the 3 most common symptoms for which they seek consultations.
And does it have any age range? Does it happen in the kids? Does it happen more in the adults or maybe people who are senior citizens?
See, it begins in children.
Okay.
Essentially, 2-3 years old children would have this problem far more. And that time it tends to recover, have another set of infection, another perforation. Again, it may recur, and sometimes it can make such a large perforation that it stops repairing itself.
Oh. So, sir, I'm now really intrigued to know, is there any simple way, जैसे हम लोग बोलते हैं ना घर के नुस्खे, so something that we can do at home and we can check if we have these perforated eardrums or if there's any issue with the ear or with the listening part of it? Do we have some simple activity that we can do? Or
Yes, we have. You see, there is something called nail click. If you can see here, the way I'm moving my fingers, clicking my nails.
Right.
If I do that, I can hear.
Yes.
And then I take it away, I can still hear. And up to 3 feet, you should be hearing it. If it is not heard, then you have some problem of hearing. You do it 1 year at a time and you know it on both sides.
And let's say if somebody just cannot hear it after 3 feet, is that okay?
After 3 feet, it's all right.
Up to 3 feet is something that is minimum they should be able to listen to. Wonderful. So about the perforated eardrums, the hearing loss, can it be treated with medications or does it need surgery? And how can we decide whether medications will suffice or we need a surgery?
No, for this, it's not only this or only that. It depends on what exactly you are treating. Now, if you are treating a perforated eardrum which has not healed over a period of time, this eardrum is not going to heal by itself.
Right.
This will definitely call for surgery.
Okay.
On the other hand, my eardrum is all right. I suddenly get a middle ear infection, and that pus behind the eardrum makes a small hole in the eardrum and flows out. Then that needs medical treatment. It doesn't need surgery at all. So not every perforation needs surgery, but those ears or those perforations which need surgery can never be treated by medicine alone.
So, doctor, since we are talking about hearing loss, surgery, and medication, I'm sure initially there were some traditional methods of surgery. And then how this stitchless surgery evolved. Can you tell us more about this?
See, when I passed my MS, that is, I'm talking of something like 1980s. That time, the way to do ear surgery was you make a 5 centimeter long cut, lift up the pinna, push it away, take a fascia graft from there, remove some bone, reach up to the drum, and replace this fascia where the drum is supposed to be. And the fascia will now become drum and work accordingly.
So this was a long process, I
That
suppose.
was a longer process, yes. And it had its own defined amount of complications that used to be there.
Right. And now if we talk about the stitchless surgery, what are all those things that are avoided? So if I have to put it in words, traditional method versus the stitchless surgery.
First and the most important thing will be that there will be no cut.
Right.
All the surgery is done through the canal. So there is very little pain after the surgery.
Right.
There is no scar. The surgery is done a little quickly than the traditional surgery.
Right. So, doctor, you just mentioned about fascia.
Yes.
Can you tell our listeners more about what fascia is?
Yeah. I'm sorry I'm using that word, not understanding that I may be talking to non-medical people, but understand that our body is covered with skin all over. Under the skin, there is another thin layer, which is called fascia, running all across the body. It is whitish in color. And the skin color can be any of the colors, like yellow, brown, white, or whatever.
Right.
This fascia runs all over the body, just under the skin. So you lift up the skin, and what you see is fascia. Okay. This fascia is different in different places, the same way as your skin is different at different places. The fascia behind the ear is also a fascia, but it shrinks during healing phase. Oh. And if you have a perforation and you have used this as a graft, it may shrink. And if this is the perforation and this is the fascia, it shrinks and reopens. So sometimes the fascia, the eardrum repaired with fascia, may reopen to have another perforation. Oh.
And even that's why the healing time is
And the healing time is longer. Yes.
Right. And whereas when we talk about the stitchless surgery, we bypass all these issues.
Yeah. So the fascia from thigh does not shrink as much as the fascia from behind the ear. So there are less chances of reperforation if you use fascia lata or fascia from thigh.
That's a wonderful, in fact, what do we say? Addition to my knowledge bank as well, and to our listeners' knowledge bank too. Wonderful. So, doctor, my next question is, we would love to know more about those times back when you were researching on this fascia for the stitchless ear surgery.
Oh, yes. See, there was a time when I was looking at alternative to the fascia from behind the ear. And I knew what I was looking for, but I did not know how to go around it.
Right.
Ultimately, when after quite a bit of thinking and observation, we settled down on the fascia from thigh. But the problem was, how do I prove it? Right. So after a lot of manthan, we ultimately settled down on doing an experiments on the dogs.
All right.
So we gathered stray dogs. We did all that needs to be done for, we dewormed them, we deloused them, we gave them proper nutrition and all that. And then we took them up for surgery. We did fascia grafting from behind the ear and from the thigh, and we measured it and we proved that yes, the thigh skin shrinks or thigh fascia shrinks far less and very predictably less, whereas the fascia from behind the ear shrinks a lot more and most unpredictably.
We would love to know about your first experience when you did this, the first patient that you might have treated with this. How was your experience about that?
My first patient was a lady, a young girl actually. She's now lady, but at that time she was a young girl who first entered my clinic very apprehensively and looking at me and everything else also with great suspicion. I couldn't understand her, why she was looking to everything with suspicion. It so happened that this girl was operated 4 times in past before she came to me by most renowned names of ear surgeons in those days. And she had 4 times failed in getting the result what she wanted. She wanted her eardrum perforation to be sealed so that she does not get any further discharge. She was least interested in hearing any further. I did not want to hear from this ear. It doesn't matter, but the pus discharge should stop.
Correct.
She kept on coming to me for 2 years at different occasions. And almost after 2 years, with her suspicion settling down about everything with respect to ear, she one day gathered enough courage and told me that I want you to operate my ear.
Oh, so it took her 2 years to put that faith.
And then the big thing was, I told her that I will take fascia from this ear.
Okay.
And she said, you do what you want to do, don't touch my other ear.
Okay.
Now, where do I get the fascia from? Because it was used during previous surgeries.
Correct.
So there was no more fascia or perichondrium or any type of tissue left over there.
Correct.
That put me into big difficulty. I did not know how to go around. And I told her that I have never done this surgery before. And nobody else had also done it.
Right.
So after all these experiments and all that, we both agreed, yes, she will be the first patient and I will be the first surgeon doing it. And let's hope for the best.
Fantastic.
So we went around. And one fine day, we settled down and we operated her. That day, I had gathered at least an orthopedic surgeon behind me, an anesthetist behind me, another ear surgeon behind me, and we all were in the theater. Hopefully nothing should go wrong. Well, nothing did go wrong, fortunately. But for next 1 month, I was absolutely nervous. I did not know what is happening with her. I would phone her up twice a day. Are you all right? Are you all right? And she would tell me, yes, I'm all right. I'm all right. And at least once a week, I would see her.
Okay.
A month passed by, and then I was relaxed because I could see that the perforation had healed completely. And then I told her that now you will never get discharged. Wow. This is almost 35 years old story.
Oh.
Now she's a lady with 2 grandchildren, and she does not have discharge at all since that.
With the perfect ears. All thanks to you. I think this is a story to tell for all the generations to come. So, doctor, now tell us more about these days. Now, with the advanced technology, how are the stitchless surgeries done today, and how have they improved people's life?
You see, now we don't take cut behind the ear,
right,
or over the ear or above the ear. We make a cut directly inside the canal. We lift up the skin, we lift up the drum, we put a fascia over there and close it and come out. This has reduced the time, this has reduced bleeding, this has reduced healing time.
Okay.
Less pain. And because the fascia shrinks less than other fascia, it has greater chance of healing also.
Right.
So with less of pain and less of scar and less of stitches, you get better results.
Wonderful. So if we have to talk about how long would a traditional method take and how long does a stitchless ear surgery take?
On an average, regular surgery would take about an hour.
Okay.
Whereas we finish it in 20, 25, 30 minutes.
Oh, it's half the time.
Half the time.
half the time. So no scars, no stitches, less pain,
And
better
this
healing.
can be done under local anesthesia, whereas behind the ear, you necessarily have to have a general anesthesia.
Right. So do you think that has also given people a lot of confidence to do ear surgeries for the common man?
Yeah, I have hundreds of families
Mhm.
which will stand up and tell that we have five persons in the family who have been operated by you,
All
or
right.
7 patients.
Right.
So there are a large number of families and patients who come up like that you are our family ENT surgeon.
एब्सोल्युटली जैसे फैमिली डॉक्टर होता है वैसे फैमिली ईएनटी सर्जन तो पहले जो लोग रिलक्टेंट होते थे सर्जरीज के लिए बिकॉज ऑफ दिस इनोवेशन नाउ
They come up more.
यस यस and they must be less scared about it now.
Yes. And I do get pilots particularly coming from all over India
Okay.
who come here only to get their stitchless surgery done, because pilot is one profession or one job where they don't allow perforated eardrum, nor do they allow operated ear.
Oh.
So once you get a scar, you cannot fly any further.
Oh, all right. So this is like a boon for all the
Yes.
people who are seeking being pilot as they're taking up careers as pilots. Amazing.
There is something called test pilot.
Okay.
Test pilot would be a pilot who, if the aircraft is ready, for the first time somebody has to fly.
Right.
And the person who does this is called a test pilot.
Oh.
So those are people who are chosen few, who after a lot of other training ultimately will come down to test pilot level.
Right.
I have done 2 test pilots operation who came down over here from Delhi to get their surgery done.
So does that imply that there are very less ENT surgeons who perform this surgery?
At that point of time, there were very few. Now there are some numbers.
Right, right. That's incredible to know. People flying in from Delhi to Nashik to get it done from you, doctor.
Yeah.
Hats off to you. So, doctor, now let's talk some numbers. How has this surgery improved the success rates?
See, when I passed my MS and when we were doing a regular behind the ear cut surgery, the success rate was approximately 40%. That means if you operate 100 patients, 40 of them would settle down, where 60 would again have symptoms and you have to redo them and all that.
Right.
This, with improved instruments and improved microscope and improved quality of things around, improved to some 70%. From
Okay.
the 40%, it came down to 70%, and it further continued to improve. So today we have behind the ear surgery people doing it, and those who do from inside or directly from the ear canal. The success rate for us is 98.5%.
Wow.
Whereas if you use temporal fascia, then it is less. How much less would differ from surgeon to surgeon.
Right.
But anywhere around, say, 90%. So we have 98%, and with the temporal fascia or fascia from behind the ear would be 90%.
I think that's a big number.
That's a big number.
Going from 40 to 90 and 98% is huge.
Yes. There is a reason why people... See, when I joined this department and I was working over here, the general idea people had was, कान का ऑपरेशन किया तो तू बहरा हो जाएगा, नहीं तो पागल हो जाएगा.
Okay.
That was standard. Everybody believed that, and it was never do ear surgery was general sort of impression people carried.
Right.
At least the way people looked at it when I was in Nashik, or people of Nashik of that point of time were having the idea. Today, it's nothing like that.
Right.
Today, they come very clearly, all right, I have a hole, I know that, and I want you to operate.
Right.
Through the canal, through the ear, without stitches, and we do it.
I think people are getting more aware as well.
A lot more of it.
Right.
A lot more of it.
Also, they're getting aware about the implications they might have if they don't treat it in time. And that is,
in fact,
and plus, thanks to the stitchless ear surgery, which is giving them a lot of confidence कि भाई ठीक हो जाएंगे. This is not going to last for a lifetime.
Absolutely. In fact, when I came here and when I would hear people talk like that, I used to feel very hurt inside that
Right.
it's my department
Right.
and people talk like this. But they were not wrong. I used to tell my family that even if I change their mindset from what they believe now to what is true, I have done a great successful job of my life,
Absolutely.
which I think I have done now.
Yes, absolutely, you have. And it is not just about that one person in that family. I'm sure that is going to have a ripple effect on the generations to come. Because let's say if the elder member of the family has some apprehensions about some surgery, then that even the coming generations will have that fear. They will also be scared in case they are facing some sort of an issue in the same area
Yeah.
as their elders. So I think you are doing a fantastic job, doctor.
Thank you.
So डॉक्टर वी ऑल नो दैट जब हमको एक चीज से दूसरी चीज पे ट्रांजिशन होना होता है, शिफ्ट होना होता है, अ लॉट ऑफ टाइम्स देयर इज एप्रीहेंशन, देयर इज रिलक्टेंस, डर होता है ये होगा कि नहीं होगा. सो व्हेन यू केम अप विद दिस इनोवेशन and when you successfully did your first surgery, you did all your tests, how was this innovation received by all the other doctors?
You see, initially, nobody believed it.
Right.
They would say, this does not exist, this cannot be done, this is wrong. We are talking lies. But as we continued, we did more and more number of patients, and this word spread around. There was a complete disbelief. Then I was ridiculed. तो कुछ भी करता है, ऐसा नहीं करो, this would happen, that would happen. They would keep telling me all sorts of imaginary complications.
Right.
For me, I had large number of patients by that time who never had those imaginary complications that my colleagues would tell me.
Okay.
So I now had data with me, I now had experience with me, so I would continue despite the fear of hell that they would try to implant into my head.
Right, right.
And over a period of time, it so happened that now the patients started demanding that if any surgeon, at least in and around Nashik, who wanted to do it, if they do it, they would not know the name, so they would say, Stitchless surgery karega, then only we will allow you to do it.
Correct.
So now the surgeons who first ridiculed started to know that we have to learn this because the patients would not agree otherwise.
Correct.
And for that, we started holding ear surgery workshops. So since last 25 years, we are holding those workshops whereby we train them, we show them how it is to be done. We make them do it on the cadaver, and that's how the things have spread. And now a large number of surgeons, at least all around Nashik, North Maharashtra, and some other parts of Maharashtra also, they're doing it on a regular basis.
So now it is accepted with grace.
Now it is accepted, and the papers doing this research are all published in one of the most reputed international journal,
Right.
called as the Laryngoscope. It's
So
it's a US based journal dealing with researches in ENT surgery.
So that must have given you a sort of an upper hand and to tell people this is
So I mean, for me,
tested.
this is, for me, it was all set. Now, there is nothing. I mean, for me, I have done.
Right.
And patients are in thousands. We have by now done 18,000 ear surgeries this way.
Oh, that's a great number. And successful surgeries. Wonderful. So, doctor, we all know that you are impacting thousands of lives, and all of your patients and people, those who might become your patients, talk so high about your diagnostic accuracy. Can you please throw some light on it?
That, I believe, is kindness and nicety on the parts of my patients. We do what we need to do. We use microscope, we use suction machine, we examine each and every patient in great detail, even at a little bit of discomfort to the patient, because ear examination is not a very pleasant examination to be done.
Absolutely.
But if you want to achieve a correct diagnosis, then you have to maybe feel uncomfortable to the patient, but still do it. And once all the debris are removed from the ear canal, you see everything very clearly, and that's how you make proper diagnosis.
Right.
So I don't think we are doing any magic, but we are doing things correctly.
That's a wonderful sentence. But then, yes, for a layman or for a common man, it definitely is magic. And really, congratulations to you on changing people's life for good.
Thank you. Thank you very much.
So, doctor, indeed an innovation for millions. Now, there are a lot of medicos or some of the students who are going to be the future of the ENT world, who are going to be the ENT surgeons of India. We would really love for you to give them some message.
Well, all of you have sparks. You all think. And if you think and if you believe in your thoughts and your ideas, and your colleagues call it as madness, then that's right.
Wow.
Work over it and you will be there. The success will be yours. So any new idea is always ridiculed to begin with. But once proved, it doesn't get any more ridiculed. But you have to have a dream. You believe in your dream. Let your colleague call you crazy and work, and you succeed.
But that's an amazing analogy, I think, doctor, because unless you have dreams and desires, you will not be able to achieve your goals that you have set. And unless you're called mad, because all the great people that even we have seen, there is some sort of craziness, be it people those who have big records to their name, be it people. So I was other day watching a podcast of Michael Phelps, the greatest swimmer of all times. And this guy, for 6 long years, he hasn't missed one single day of his swimming practice. I think that's conviction, that's dedication. And when you are mad for that goal, nothing is impossible. So wonderfully, wonderfully told. Finally, I would want you to give a message to all our patients.
Well, go to the doctor when you need to go. When you have symptoms, don't neglect those symptoms. And if your surgeon says that you need surgery, do get it done. Find the best surgeon who will do that particular job the best. And then once you go to him, let him do what he is doing, because he is trying to do things good for you. That's all I would say to all my patients. Trust your consultant.
And that's wonderful. I would like to add, please don't go to the Google doctors, for God's sake.
Yes.
So go to a
Don't
specialist.
Google at all. I can recall an incident that occurred where a patient had a furuncle over here, and that is the same place where you get preauricular sinus. And 3 of them, one girl and 2 gents or 2 males, the 3 came and said that, look, this picture looks like this, and this picture on Google says you need surgery. I said that you don't need surgery, you go away. Next day they came again with a video of the surgery, and they said that, look, this surgery we want you to do. I said, she does not have this disease. What do you want me to do? Ultimately, I said that you go to somebody who will operate for you. I am not going to do that. They left my clinic very unhappy, but I stuck to my guns that you don't need it, and you don't think it is so easy to understand medicine. I have spent my life studying medicine, and I'm still learning. And I don't think that my study is over yet. You do it in 2 days or 1 day.
So, doctor, how would you treat someone who's already deaf?
Yeah, you see, people who are deaf can get cured or settled with medicine, with surgery, or if both of them are not working or are not suggested, then you need hearing aid. Now, if your surgeon says that you need hearing aid, please do put on hearing aid. A recent research has shown that Alzheimer's occur because of deafness. You are cut off from sensing the world around you through vision, through sound, through touch, and through taste and smell. Then your brain is completely isolated, and Alzheimer then sets in.
Right.
So if you want to avoid Alzheimer, then please use hearing aid. It is better to be called deaf rather than mad. Otherwise, you are mad. And don't be that. Let people call whatever you want to call. You cannot hear, you use hearing aid.
Right.
Of course, now we have even cochlear implants and brainstem implants coming in. A lot more research has happened over a period of time, and a lot more avenues are available to resolve hearing loss. If you need hearing aid, do put it on.
And nowadays, doctor, even the hearing aids, they have become so tiny.
They've become tiny and
Right.
they're far more crisper to hear
Right.
than the hearing aids available of yesteryears.
Right. Thank you so much, doctor. It was absolutely useful information, not just for me, but for all our viewers, all our listeners, and for every strata of the society.